Beauty scientists, Dr. Kristy Hamilton and Dr. Roy Kim. Real beauty without the hype.
So what's a typical day look like for you now as a attending?
So as an attending, I do have certain days that are reserved for seeing patients and certain days in the operating room. I tend to like operating just all day or most of the day as opposed to operating sort of a little every day. That's just my preference. And certain days when I see patients, I'm seeing new patients, I'm following up with old patients, I'm actually doing injectables or small procedures in an office setting. And then certain other days are reserved for the operating room where we're doing everything and everything. For the most part, it's outpatient, as probably your practice is.
Mm-hmm.
Most plastic surgeons are probably an outpatient or shorter operation or not quite as medically unstable patients. But I think that's the nature of plastic surgery.
Yeah, I agree. So my practice is 100% outpatient as well. I also prefer to like do clinic on clinic days and surgery on surgery days. And then I do local anesthesia cases one morning and then a short clinic that follows. So I like keeps it structured, helps ensure that I'm not running behind in surgery, hopefully, and then having patients waiting for me on the other end. And I like that structure. So I think structure like really helps me be efficient in my day and I think take best care of patients. So, now that we are running our own practices, we can create that structure, which is nice. You're not at the mercy of like the hospital OR schedule. So that's really, really good. What do you think is the most difficult part of being a plastic surgeon?
I think, first of all, you have to be crazy enough to do it because it is a lot of work. There's no way someone can force you to do this. You have to really like it to love it, and you really love it. It's a lot of work in training. It's a lot of different work when you're out on your own because even if you join a group or hospital, you still have to sort of carve out your own niche. If you're starting out on your own, then suddenly you have to learn about small business and admin and marketing and hiring people and all that stuff. So that's a completely different skill set that we're not taught in college or medical school or plastic surgery training. And it's like running a small business. And you have to be physically tough, maybe not super tough, but you have to have endurance, stamina. Most of the plastic surgeons I know of, actually, virtually all of them, are high energy people who are motivated, who want to fix problems. And
Mm-hmm.
mentally, you have to be tough because you have to deal with difficult cases. Sometimes you have to deliver difficult news to patients or sometimes you're just having a difficult time with HR issues. So those are the things that I think, they're looking for in plastic surgery. And, both you and I have been through the training. What are some of the awards that you've really, really loved about plastic surgery?
I mean, the best is when you have patients coming back and they tell you that you've changed their lives. In residency, I mean, it was so tangible, the reconstructive patients. It's like, okay, they couldn't walk. Now you help them walk, probably in conjunction with an orthopedic surgeon, but saving somebody's hand, piecing someone back together, reconstructing their breasts, after breast cancer. I mean, those are just so powerful on the aesthetic. And now when patients come back and they're like, I've always hated my nose. Now, because with this new nose, I just feel like confident enough that I went for that promotion, or I don't like I'm not shy anymore. Like it's amazing how these sometimes very small changes can really enhance someone's confidence. And so that's the best for me, is just like a patient coming back being like, this changed my life. Because everyone's different in terms of what that thing is. And if I can be part of that journey to help them with their life in a fuller way, then that's a win. My second favorite thing is just my team, like building our team. I love the women I work with. I think they're just phenomenal humans, and getting to like create this practice as it continues to grow. And we're always trying to innovate and take better care of patients. That's been really rewarding too. And I think you and I both just love operating as well. Like I'm so grateful I get to do what I do every day. It's like intellectually engaging. I love it. I love getting to use my brain that way, and then like also my hands.
Yeah. One of our mentors, Dr. Rorik, has always said, the anatomy is always the same, but every patient's different. So you've talked about, how each approach is a little different. This is how we're doing a facelift or rhinoplasty or whatever. And it's the same procedure, but it's not the same procedure because everyone is different.
Thank you for joining us on The Beauty Scientists. Be sure to visit thebeautyscientists.com and learn more about modern beauty and connect with Dr. Hamilton and Dr. Kim.